GBC News. Real-time news is where we link up with our correspondents across the country to bring you news as it happens. We'll begin from the northern part of the country. The World Health Organization says breast cancer killed 685,000 people in 2020 globally. Even though women are the most affected, men are not spared. So to help minimize the menace, some institutions have taken up the challenge to educate people about the dangers of the disease and the need to do regular screening. One of such institutions is the Upper West Regional Branch of the Controller and Accountant General's Department, and our regional correspondent, Swala Abdul-wahab, is standing by with some details. Swala, thank you for joining us. We know October is Breast Cancer Awareness Month across the globe, and many people do have a lot to share. What can you report?
In your intro, breast cancer is one of the diseases that affects many women across the world. And it is so because experts say many of the people who are affected are able to detect the early stage of the disease early. So the disease travels to a length before these affected persons are able to detect it. And this is what, according to experts, say is causing the disease to have a debilitating effect on its victims. But we are at the offices of the Controller and Accountant General's Department, which has organized the creation of awareness and screening exercise on the disease. We would like to engage the regional director of the department, Mr. Lambert Siglo, to tell us more about why the department decided to organize this awareness piece. Thanks for joining us now.
Thank you very much. The Controller Accountant General Department working through the Controller Accountant General himself from the headquarters, place premium on the welfare and health of its staff. This month, October being the breast cancer month, the Controller Accountant General in Accra, through the welfare, decided to organize breast cancer screening for controller staff across the country. Today, this screening is going on in all the 16 regions. The Upper West region, we are having it here, as it were, look at the breast cancer, as we all say, it's a very bad disease for staff. Initially, we targeted for only staff, but there are other departments around. We have invited all of them and they have participated very well. The health personnel were here in the morning and they have done a lot. As you can see now, work is still ongoing. We also opened it to the general public because we are located in the center of town. And I want to use this opportunity to thank the Controller Accountant General, Mr. Kwesi Kwani in Accra, and all the welfare executives who have made this thing possible. They said a healthy staff will be more productive, and that is why this thing has been put in place. We also locally here, the health authority decided to add other screening disease, something like BP and then blood sugar to the exercise. So it has been very, very magnificent. People are happy and we are looking forward, even though our hope was that, or our hope is that we don't want to have any positive breast cancer detection. And so far we haven't heard any of them. But we're assured that if there's any, the early detection is very, very important for medical attention. Thank you very much.
Yes, but why do you think this is necessary for your staff?
It is necessary in the sense that, we are accountants. We are always busy with dealing with figures, trying to make, as government accountants, if you look at the Public Financial Management Act, Section 8 of the Act is saying that the Controller and Accountant General, and for that matter, his staff, we are supposed to be in charge of the custody, safety of government funds. So we are always busy doing that. And some may forget to take care of their health needs. So that's why the department decided to bring this one to their doorstep. You see, most of them came out from the office to have this screening. So it is very important for the department.
Thank you very much. You've been listening to Mr. Lambert Swulo. He's the Upper West Regional Director of the Controller and Accountant General's Department, talking about the rationale behind the screening exercise. He is saying that even though they are in charge of ensuring that government space is protected, they are also mindful about their health. So we are talking about breast cancer. The experts are here. We want to engage one of the health officials who is leading the exercise. She is a Deputy Director of Nursing Services, Madam Beatrice Tingan. She joins us now to tell us more about breast cancer. Thanks for joining us live or in time. So, what is breast cancer?
Well, just like the name, breast cancer. Cancer is just an abnormal growth of the cells in the body. So, cancer is just an abnormal growth of the cells in the body. So, breast cancer is also abnormal growth of the cells in the breast. The body is supposed to control the way the cells grow within the body. But a point will come that the body loses control of the growth of these cells. So they grow abnormally. And when that happens, it can happen to any part of the body. We call it cancer. So that is breast cancer.
So, why are we to be worried about breast cancer?
Well, we have to be worried about breast cancer because it can kill, and it has been killing, and it has killed a lot of women. This morning we had the education session, and a man gave an experience about how the wife died of breast cancer, and he was so happy that we are doing something like that. So every day in our work, we give education about breast cancer and other diseases, but this particular month, October, is dedicated to just breast cancer, creating awareness to the public about breast cancer, the causes, how you can prevent it, and all that, so that people can be aware. They can go to any of our facilities where screening is ongoing, particularly for this month, so that you can be screened, physical examination. If there are any lumps detected, we can refer you to see a doctor. A mammogram can be done to detect further complications and then treatment given. So basically, this is what we are doing about breast cancer.
So, how do you know that you have breast cancer?
Well, mostly breast cancer will start most of the times with an abnormal lump in the breast. Most people will say, oh, they detected an abnormal lump in the breast, or maybe it can come with pain. Sometimes the breast can be very hard and then with some pain. Sometimes there may be some fluids coming out of the breast. So any abnormal thing that is happening around the breast might not be cancer, but when you report it, further diagnostics can be done, like I mentioned, the mammogram, to detect if that growth is actually a cancer. And if it is detected early and treatment commences, we can save your life for you. So these are some of the signs and symptoms that can show that you have a breast cancer.
Is the screening free?
Yes, the screening is free. What we are doing here is physical examination of the breast. So we palpate the breast to find out if there are lumps in the breast, and then also to find out if there are maybe certain abnormalities, discharges from the breast. So it's basically free. We are not charging for anything. And if we detect any abnormality, then we refer you to see a doctor. But where you will have to do a mammogram, the mammogram is not free. At the hospital, you will have to pay for it. But for what we are doing is free.
We hear some of you, the health experts, say that it is good to do the screening early. Why is it so?
Yes, so that if it is detected early and treatment commenced early, then you can be cured. The cure rate becomes high when the cancer is detected early. When you do the screening and we detect a lump, then we refer you. If they do a mammogram and other examination and then they realize that it's a cancer, quickly it is removed. And if it is removed, there's no opportunity for it to spread to the other parts of the body. But if you don't detect it early and then it spreads to the other parts of the body, then you are likely to go into other complications and you may lose your life. That is the reason why early detection is very key when it comes to treatment and then cure.
But physically, it is women who have breast. Men do not have breast. So are men also affected?
Yes, men can also get breast cancer. Even though the tissue of the breast of the men is not as big as that of the women, but it can also outgrow. And then you can also get cancer. Just that women are of more risk. Women easily get it more than men, but men can also get breast cancer. So men should also take it as an opportunity to examine their own breast.
But there are some group of people who think that when someone has breast cancer, it is a curse. How do you respond to this?
Well, that is just a belief. It's a belief system. But scientifically, it is not. Scientifically, it is not.
Anybody at all can get.
Anybody can get cancer. Whether you are cursed or you are blessed, you can get cancer because it's a disease condition and it can affect anybody.
So at what stage of it can you start accessing treatment?
The moment it is detected, you don't have to wait, except that you are not aware of it. But at any moment in time you detect that this is the issue, you will have to seek for medical treatment.
And is it curable?
Yes, it's curable, especially when it is detected early. It's curable. There are, we have chemotherapy drugs that they can give you. We have other treatment measures that they can put in place depending on the stage that they find you, and then you can be cured. We have a number of people who have been cured from breast cancer. I think 3 weeks ago, we had one of these screening sessions, and one of them came to give a testimony about how she started with breast cancer and she has been healed. And especially in this month, when you watch TV stations, we have a lot of those patients who have been cured from breast cancer, giving their testimonies, encouraging people to go in for the screening. And if it is detected early, then you can be treated.
So, Madam Beatrice, the whole Ghana is watching you. What do you have to tell both men and women?
Well, my message I want to tell both men and women, especially to women, is that this particular month is breast cancer awareness month. If you have never done examination on your breast, go to a health facility and get it done for you. And the health workers will even teach you how to do self-examination of your breast at least once every month. And then for the men, I want to plead that they should support their wives in terms of the breast examination. We have what we call male involvement. You can go with your wife to the facility, and you too, as a man, can learn how to do the breast examination and do it on your wife. And then we can all help in protecting the lives of women when it comes to breast cancer. Thank you.
You've been listening to a Deputy Director of Nursing Services, Madam Beatrice Tingan, telling us what breast cancer is, the causes, and how the disease can be controlled. The message here is that everybody is susceptible to breast cancer. It doesn't matter your age, your sex, or whatever. So the important thing is that always make sure that you have a regular screening of your breast to ensure early detection for effective treatment. Back to you in the studio in Accra.
Thank you so much, Swala, for those updates. So screening exercise by the Controller and Accountant General's Department in the Upper West region for breast cancer, early detection is key. Our correspondent Swala Abdul-wahab has brought us those details there from WA.